Good day, all. I'm Caress Clegg, and we are back with another Ready, Set, Return informational series to share information on the 2020-2021 school year opening plan. Today, we will be discussing health and safety and how the Student Support Division will be working to prepare and implement measures to ensure the safety of not just our students, but our staff as well. With me, I have Assistant Superintendent of Student Support Services, Julie Varnum. Ms. Varnum, thank you for being with us today. I would like you to just start off by introducing yourself and telling us a little bit about what your division and your work group does, who they encompass, and the areas that you guys have been looking at.
Okay, thank you. Thank you for having me. Like Caress said, I'm Julie Varnum, Assistant Superintendent for Student Support Division. Our Student Support Division focuses on school health, school social work, school counseling, special education, and providing overall student support services so that our students can access their learning, their instruction. We cover some areas of safety specifically related to students. So the work of our division lately has been working alongside human resources in the health committee planning. So when the governor and the North Carolina Department of Health and Human Services released their documents and the toolkits for allowing public schools to return to face-to-face instruction, and with the potential plans, we began working on what that would look like, whether it's Plan A, Plan B, or Plan C. While we do not know, because the governor has not announced the plan yet, we've been working on what might this mean for us based on the different measures, the different precautions, and the different plans. So we have really focused on some major questions of, who's going to be our most vulnerable populations. That's including students and staff. And we want to have strong consideration for families as well. We want to make sure that we have a plan for supporting those folks in our school family who might get sick. How do we support our staff so that they can return to the work that they love and that is so necessary? How do we support our students and their families so that they can return to face-to-face learning or whatever learning is most appropriate for them at this time? So we have been talking about our more vulnerable populations, our students with special needs, maybe even special medical needs, our students that are identified as deaf or hard of hearing, our students identified with visual impairments. What types of supports do we have for those? What types of masks are most appropriate for staff in working with those children? Our biggest concerns have been trying to balance the processes and guidelines, and also in many cases the requirements, with the overall risk, mitigating the negative outcomes. So while we are really focused on the medical and physical health during this pandemic, we are really still very much focused on the social, emotional, mental health of our students and their families, and along with our staff. So we've been really, really busy. We have found that we have more questions than answers, but that has just required us to come together daily working on how would we handle this situation and how would we handle that situation. And so really the team, I pulled together along with our human resources team, we pulled together a team of principals and then other support staff. And on our we also are including our Assistant Director for Public Health for New Hanover County. And we have a unique situation with our relationship with public health in that every one of our school nurses are public health employees. We contract with the public health department for our school nurses. And that means that while our school nurses are on our team, they are employed by and supervised by public health. That is a tremendous blessing at a time like this. We find it to be a blessing always, but it's even more aligned with how we need to move forward and making sure we don't miss any key elements of public health.
So you talked about the vulnerable populations within our school district, both students and staff. Can you talk a little bit about what plans you guys are developing or that are starting to form to address those students and to also address our students with different learning needs?
Yes, yes. So, while we are continually in the planning phase, we have identified some priority considerations. So we know that we will be working with smaller groups, and we will be creating physical distancing. We want to make sure that we aren't eliminating socialization, peer-to-peer learning, and communications. We're also focused on the type of PPE that we need for working with certain students. So, our students who are English language learning, our students who are learning language differently than maybe typical students without a hearing impairment, or our students that are navigating their or orienting themselves to a school building as a student with a visual impairment, that's going to be different. So, how are we going to provide staff with a greater understanding of sanitation of even walls and maybe certain areas where our students with a visual impairment are using that for mobility and orientation? We don't want to eliminate independence of our students. That is going to be counterproductive to development. So, in all of this, we're trying to consider how do we maintain learning? How do we still promote overall health and well-being in an instructional environment, but protecting as much as we reasonably and possibly can from risks of this contagious and dangerous virus? So, certainly equipping our staff with different materials, with screens as opposed to face masks, and teaching our students that this is okay. This is a precaution. This doesn't mean that I'm sick or I think you're sick. This is a precaution because we have to use these universal precautions no matter what.
You talked earlier about our staff. What precautions or what are we looking at as far as our substitute pool, and are there concerns with not enough substitutes?
There could be. So we actually, I think today or in the next day, we are releasing a survey of our staff, and that will include substitute teachers. We have some data on the return rate of substitute teachers that has us concerned. It like some are deciding not to return during this time, but we're going to specifically reach out to all of our staff and try to gain an idea of comfort level, try to gain an idea if our staff of whether our staff are going to really need remote options, remote work options, remote teaching options, if they're more interested in doing that as opposed to face, if they're not concerned with face to face and they know that they can follow the precautions and be face to face with students. We also need to know among our staff, if they have children of their own that are going to need childcare options in the event that we're not on a daily school schedule. So, among our substitute teachers, we have also talked about needing to isolate substitute teachers to certain buildings. We want to make sure that we, just like our plans, for example, for recess, having zones outside on the playgrounds, or during break areas for our secondary schools that really don't allow mass commingling. We really need to keep students and staff in certain groups so that if one person is sick and has been contagious and we haven't been able to minimize risks, then, and we can't minimize all risks, then we want to make sure that we have an isolated zone or isolated population to be able to respond to and support public health screening. Mm-hmm. So we want to make sure that our substitute teachers are working for only one particular school, and maybe even identifying a couple that are there continually. We don't know all of those answers right now because we don't actually have an idea of the staff that are returning.
So let's go into a scenario. I know we've mentioned temperature checks for students and staff before entering the building. What happens if someone has a temperature when they arrive at school?
So I'll answer from the arrival at school, and then I want to talk about some prevention pieces for getting into the situation. So we're going to have that happen. And you know, honestly, during a typical school year and a typical school opening, we're going to have students who come in who might be sick or have a fever. It may have nothing to do with the current health situation in our community, but we are taking all of the advisement from public health. So if a student comes in, we will screen at entrance, and if students are sick or symptomatic, have a fever, they will be isolated with a staff member to protect them and keep them safe and help explain you're not well, so we're calling on your parent or your caregiver that your parent has identified to come and get you. So we are also trying to determine, you know, what are our options for having multiple students who come in who have a fever or have other symptoms. How do we isolate multiple students? How do we identify the staff to support those students? We of course don't want to put all 6 students in one space, even physically distanced. We want isolated areas, and our public health toolkit lays that out for us. So really, our process is going to be identifying which staff will be supporting those. From the perspective of the parent, it's going to be really helpful, and it's going to be essential for parents to support in the screening of their children before leaving for school in the morning, whether it's walking to the bus stop or whether it's before getting in the car to be dropped off. Screen your child, and if your child has a fever or has other symptoms, then stay home. We are going to be very flexible and lenient with attendance policies. Just let us know. If a child does come in and we're isolating them, we're going to be calling the parent, and then we're going to want parents who definitely, you know, have to work or might not be able to get there, might not have transportation readily available. We want parents to work with us in identifying other potential caregivers that can offer transport, that can come and pick up their child. Also, by the same token, having other caregivers or a responsible adult meeting with a child at the bus stop, so that even if you screen your child at home and they're fine, and by the time they're at the bus stop, and we're doing quick screening at the bus stop and they have a fever, we will not leave your child at the bus stop alone. And so we're trying to determine, what do we do? And I know our transportation division is working on this, but what do we do when a child is sick at the bus stop and we have to make the choice? Do we bring the child onto the bus with other students? Do we wait here? Do we wait at the bus stop and try to have a bus come back around? Do we try to contact the parent there? It's going to be really helpful and the most safe option for children to have a responsible adult or caregiver, if not the parent, at the bus stop with them. We know this is not helpful in scheduling, but we really want kids to be able to return to school, and it's going to mean some additional measures that don't necessarily fit into convenience.
Seems like there are a lot of different scenarios, and as you said, more questions than there are answers. What are other ways that parents can talk to their students and help prepare them for the return back to school?
Mm-hmm. That's such a good question. So I think the main thing that I think parents can do right now is really helping their children understand the 3 W's. You know, as we've seen on public service announcements, we are promoting Dr. Cohen's videos. Dr. Cohen is our Secretary for Health and Human Services. She has videos on reminding of the 3 W's. Wearing your mask, teaching our kids how to properly wear the mask, making sure I have my mask, making sure that your mask covers your face and your nose, and that you're not having to touch it over and over, because then you could be contaminating your mask. Also, making sure that our students are washing their hands frequently. If hand sanitizer is available when washing is not available, try that. That's fine. But hand washing for at least 20 seconds. Sing happy birthday, sing some song, or practice ABCs for our younger ones. The other thing is, making sure that we are understanding the physical distancing. As an elementary teacher, one of the things that I said all day was, keep your hands to yourself. Most of the time it was hands and feet to self. But helping our students, especially our younger ones, realize that right now, hands to self is a big deal. And if our younger ones aren't going to be wearing masks, because some aren't going to wear masks, if if our younger ones are entering school for the first time, we want to prepare them that this is not the time that we're sadly going to be hugging our friends, hugging our teachers. We've got to keep the distancing. We've got to make sure that we understand we're not going to be sharing all of our materials. It's disheartening in so many ways, because we want to be really excited about coming back together and excited about the social and emotional benefits of being in school and learning alongside peers and with our staff who love being among children, and having to stay distant and not being able to share materials. Imagine, can I borrow your red crayon? No, you can't. And then for, our older students, really being models for social distancing, physical distancing, but really not so much the social parts, keeping in touch, figuring out ways to be in touch. Many of our older kids have figured that out through social media, and sometimes they'd rather text somebody right here rather than talk. So maybe that's a benefit. We didn't know that we would find one, but maybe that is. And the other thing is teaching our kids that not everybody is going to use the same precautions. Mm-hmm. So we might have students in a classroom, and these could be older kids too, who are going to be able to wear a mask. Maybe they have health conditions that would make that more problematic for them. And we know that wearing a mask is really more about protecting others than ourselves. So some kids aren't going to be able to do that. Some staff aren't. This is not a one size fits all. This is, we have to help students and staff alike identify how much precaution can utilize to minimize risk, but it's about balancing and minimizing overall health risk. If there's a respiratory condition and making someone wear a mask is going to further deteriorate their health, that isn't the good option. Mm-hmm. So knowing that different people are going to be doing it differently, and that's just going to have to be okay.
That is very key to point out. I know I've seen the videos where there are people who wear the mask, who wear a chin mask, or they wear the mask and they have it under their nose. Will the district be providing support or trainings to kind of help educate people on proper ways to wear their mask and other PPEs?
Yes. So there will have to be initial instruction as soon as we're back in school, teaching our students. We normally do this anyway at the beginning of the school year. Let's talk about our processes and procedures. This year, it's going to be a little different. We might have smaller class sizes, and really teaching that, like I said, we don't share materials. We're going to have our desks this apart. Don't scooch them together. They are this far apart for a reason. And that masks need to be worn in this way so that you can prevent the risk. I think it's educating our students about the health concerns without causing anxiety and panic. But we have to realize that right now in this pandemic, we have many folks that have anxiety and panic and stress because this is unpredictable. But let's take what we know to be the best options right now and teach our kids to use those properly. Let's teach our kids that we're going to very likely have options for hydrating than water fountains. That's just probably not something we're going to do. Again, we're working closely with our school nurses as our public health officials or experts, and they are helping us identify some precautions. And we're going to have to spend some time in the beginning of the school year teaching our students the new traffic patterns through the building, looking at the arrows on the floor, looking at the lines on the floor. Does that line mean you wait here? Does this arrow mean you go this direction and not that direction? Mm-hmm. And I think that's something that we can practice when we're in public settings with our children to help them understand, oh, wait, I'm in this grocery store. This arrow is going that way. We can't go this way. We need to go to the next aisle. And so we're going in the same direction with everybody and not, coming face to face.
So you touched on this a little bit before with mental health, where a lot of concern is on the physical health and physical well-being of our students. But what about their mental being? What is the district doing to support students, support families, and make sure we are serving the whole child?
Right, right. Thank you for asking that. So this work has got to be about overall health, because we know, and we know so much more. The more we learn, the more we realize, oh my gosh, yesterday I didn't know enough. We know that mental health is going to have a direct impact on physical and medical health. And we know that you can protect from all of the physical risks and then deteriorate and have a counterproductive response in mental health. And so we always focus on, for identified students, those social emotional learning needs. But right now, we have an opportunity to work on social emotional learning embedded into our instruction, into our teaching and learning for all students. So we have been using some programs, some research-based programs for social emotional learning that have been evaluated and proven to increase social emotional and resilience among our students and our staff who teach them. And resilience means that that our kids can be a little bit more elastic, a little bit more flexible, not so rigid, and they can find some comfort and predictability in social emotional interactions and managing their stress and managing conflicts with peers, managing their feelings about others when maybe some of their behaviors look like they discriminate against others for ways they act or ways they look. We want to make sure that we are promoting social emotional learning as the integrated tool within instruction for all students. Everyone has experienced stress from being out of school, from immediately ending school the way we did in the past school year, and being quite isolated. We need to make sure that we're supporting all of our environment, all students, with tools and skills for maintaining a healthy balance in their socializations, maintaining healthy boundaries, but having empathy for others, and seeing that everything isn't the same for everybody. When we talk about equity, many of our families haven't had the same opportunities and access to some health options. For example, some families haven't been able to adapt and work from home, and everybody stay kind of isolated. But let's Zoom call with grandma. Let's Zoom call and have a party with friends remotely, and let's keep our health better. And let's buy the best of the groceries, but have those delivered. Some of our families are essential that are face to face with those who are sick or can't take precautions, and maybe also don't have the options for maintaining the virtual outlets, social outlets, and keeping connection with grandma. Grandma might not have internet access or a phone that really allows for a connection. And so I think having our students understand that right now, this is a lesson in equity, not equality and equal, and we all get the same. Equity. This is where we have to listen to others to understand what they need, and then provide what they need for their health, their physical health, their medical health, their mental health. And we need to promote that among our students. Some students are going to wear a mask, some students are not. And it doesn't mean it's a discipline issue. We're going to have expectations, but we're not going to require everybody to be the same, because they're not coming from the same place. And some students are going to need additional supports when others need the awareness, and they need the ability to collaborate and communicate to understand one another better.
Julie, is there anything else you would like to share with our parents or audience today that we did not touch on?
I think we've covered most everything. My main message would be that, we have to be in this together, and we definitely want to see our students return. We want our school communities to be active and vibrant again, and we know that that's the best thing for our community. So let's prepare. Let's prepare our children. Let's prepare our students for coming back and the way things will be, so that we can stay in school. And I just look forward to seeing you all.
All right. Well, thank you so much for joining us. Thank you to the audience for watching in. As always, have a wonderful day. And don't forget those 3 W's: wear, wash, and wait. Till next time, guys.